Hello, everyone, and welcome. My name is Sabine Delouche. I am Community Impact Director for the American Heart Association. Our mission is to be a relentless force for a world of longer and healthier lives. I have the pleasure of working in South Florida, so I work in both Broward and Miami-Dade counties to make long-term impact by working with community organizations, health centers, and lots of different community settings and neighborhoods to really make impact around heart disease. We're celebrating 100 years of the American Heart Association. It's our centennial year. So I'm excited to be able to share a little bit about our mission, but also how I collaborate in the community with great organizations and partners. And so I'm happy to be here today with one of those partners, Health Choice Network. And we're here today with Dr. Timothy Long, Chief Clinical Officer of Health Choice Network. How are you doing?
I'm great. How are you?
Very good. Very, very good. And excited to dive in. I know that I've had the pleasure of working with Health Choice Network, or HCN, for a couple of years, but I would love to dig into really like, who is HCN? What's the work that you do? And I think it's important, for our community to know about health, how we access health. And I know we'll talk a little bit about disparities in a little bit. But first, if you could introduce yourself and maybe share a little bit about Health Choice Network.
Yeah, absolutely. Thank you. This is a great opportunity for Health Choice Network to talk about what we do. We're a mission-driven nonprofit organization, and really Health Choice Network brings together federally qualified community health centers from across the country, really to provide direct healthcare services to uninsured patient population. A little bit, people might not know this is truly a mission, and the federally qualified community health center, part of healthcare started in the 1960s on the war on poverty. There were two health centers that were started, one in Mount Bayou, Mississippi, and one in Boston. And out of those two health centers, now we have 1,400 health centers across the country that provide health care to 31.5 million Americans, giving direct health care services. And generally, a federally qualified community health center, as people may not know, it is funded by the federal government, but there's other revenue streams that come into the federally qualified health centers, but they are governed by a nonprofit board, 51% of which are patients of the health center. That's a very important factor in the federally qualified community health center movement. And so we're able then to hear the voice of the community at the board level of those health centers. And federally qualified community health centers across the country all provide basic primary care services. So they hire nurses and doctors, advanced practice nurses, physician assistants to provide that service in women's health, adult medicine, family medicine, pediatrics, behavioral health, oral health, and then many other types of case management services also. So the federally qualified community health center movement, I keep saying that because, I could work in the private sector, I could work in an academic center, but I've only worked in the federally qualified community health center since 1997 when I finished my residency, and I've been in this movement since. And then specifically when health centers, basically in the 1997, 98, wanted to come together and form a network or a collaborative, Health Choice Network in South Florida was the very first health center controlled network in the country. Right now, there are about 50 health center controlled networks in the country, and Health Choice Network is the oldest, what we call HCCN, which we bring together health centers to have economies of scale to do a number of different things. Some of it's data, some of it's transforming healthcare using health information technology, using data. Also, so Health Choice Network has a lot of service lines with revenue cycle management and then clinical services, which was my area of expertise as a chief clinical officer at Health Choice Network.
Wow. I just learned something new. I didn't realize that you had such a majority of the board and representation being that patient voice, which is very important when we talk about health and how we're advancing health. So for Health Choice Network, I work, at the local level with some of the health centers, but could you maybe share what do you guys, I know you span across, is it 20 states and territories? What does that look like?
You're right. Yeah, we're over 20 states and territories. So, we did start here in Florida, South Florida. However, we're now all the way from Hawaii to Puerto Rico. We just brought a health center live with our electronic health record system recently in Puerto Rico, and we're actually bringing another health center live. It's the first time that health record system was on Puerto Rico called Epic. But Health Choice Network has expanded and grown. We probably have about 3.3 million patients that are within our network of health centers across those 20 states. There's maybe about 62 different nonprofit healthcare organizations that we work with across the country. We're growing, we're expanding. And the reason why networks are so powerful is because you bring together all of those health centers, and we have about maybe 1,100 different locations of care across those health centers across the country for those 3.3 million patients, and maybe about 7 or 8 million office visits per year. So we're growing. It's a good thing and a bad thing. You know, we serve underserved patient populations. We want to provide them health care, but it is a need across the country. Not everybody has access to health insurance, whether that's privately sponsored or government sponsored. And a good percentage of the patients that are seen within the health centers at Health Choice Network do not have insurance at all. Many of them do, but many of them do not. So we are the safety net. The 1,400 health centers across the country are the safety net for those patients.
Wow, that's incredible. And could you share in your role as Chief Clinical Officer, I mean, I can imagine over 3 million patients. That's, you know, a large undertaking, but I know that you do great work and would love to hear how you work specifically within HCN.
Yeah, so within Health Choice Network, my role as a Chief Clinical Officer is to promote the use of health information technology to advance the healthcare that's being done at our health centers across the country for those 3.3 million patients. And I work with a team called the Clinical Quality Team, where we use that health information technology to focus on a few specific clinical disease areas, but then more importantly, to use the data coming out of the electronic health record system to promote the care that they're doing at the health center, and then also to engage patients using that technology.
Okay, that's fabulous. So would love to hear about, you know, you're talking about engaging patients and the number of patients that you serve, and especially being able to reach the underserved population. So I kind of want to dig into that a little bit. And, you know, we're here today collaborating together. And how do you, I guess, first see kind of the mission of HCN and AHA aligning together?
Well, we're both working with underserved patient populations. We're trying to advance both public health and individual personalized health care. And I think we have focused on a number of cardiovascular issues. As you know, more Americans die of cardiovascular issues than any other disease state, and that's something that we can help to prevent, whether that's, you know, controlling hypertension or heart attacks and strokes. So we're both working on those disease states, and I think engaging patients is so important. And we use the technology, our electronic health record system, to engage patients using their patient portal, which is extremely important, that patients have the ability to look at their data and to be able to make decisions on their health outcomes and work with the care team that are being together at the health center.
Yes, yeah. And I know that, you know, in some of our recent work around health literacy, cultural competency, that's exactly what we're doing. Right now we're actually ending a 4-year grant that we had through the Florida Blue Foundation, which was really focused on just that. So working within federally qualified health centers, working with underserved and underrepresented patients, but especially empowering them to be able to make those informed decisions around health and talking about health literacy and working to train staff on cultural competency. But before we dig into that, I think, you know, a big reason of that, as you mentioned, is heart disease is the leading cause of death in the United States. And so what are you seeing, I guess, as some of those top factors or top risk factors within the health centers and within patient outcomes that kind of are leading to heart disease?
Yeah, so many, and some of them deal with the social determinants of health, maybe lack of access to medications, lack of access to healthcare, and that's why we exist in our mission, making sure that patients are coming into our office, making sure that they know how to appropriately, our staff, our team at the health center, is appropriately checking blood pressure, taking risk scores and engaging patients and how that they can modify their risks for cardiovascular disease, specifically hypertension being one of them. But then there's all kinds of other social factors that go into that: lack of transportation, lack of food, and then coming out of that, then we have challenges with other diseases like diabetes that factor into cardiovascular disease and health.
So you touched on social determinants of health. How do you see that affecting, we talk a lot about health disparities. Could you maybe share what is a health disparity and how does social determinants of health impact health disparities?
Yeah, so we have health disparities across the country that could be from economic, it could be geographic, it could be urban, rural, it could be lack of providers within a certain area. As you know, in some rural areas, hospitals are closing for a number of different reasons. So if patients don't have access to a primary care doctor, which I'm advocating everybody get a primary care doctor like myself, so that you can make sure that those social determinants of health are identified and then resolved. So if people do not have health insurance, that's okay. We treat people who do not have health insurance, but we also have to give them the access to the medication. So if someone does come into the office, they have their blood pressure taken and the blood pressure is high, we'll work with them on exercise, diet, nutrition, things like that, but then also getting them on medications. And so making sure that there's no disparity in if I have hypertension, I should also have the medication and have a provider who can intensify that medication.
And I think we saw a lot of that highlighted, especially after the pandemic, looking at rates of hypertension, rates of diabetes and cholesterol, and particular populations that were facing, outcomes harsher almost than other populations. And once we really started to dig into it, looking exactly what you're talking about. Well, what is access to care, transportation, food, those determinants of health? And for us, that's really how we began that journey of that health literacy and cultural competency work. It's a big, task to undertake, but wanted to be able to at least focus on a component that's like patient facing and then one that's kind of provider. So let's start with health literacy and talking a little bit about that. How would you define what health literacy is?
So I think health literacy is evolving over time, the definition of that. In the past, we thought of health literacy. Does the patient understand the language on the maybe the handouts that we gave to a patient? Are they understanding that? Is it at a grade level that they're able to read? But truly now, health literacy is they have to understand how the information, but also to help inform their decisions so that they can be an informed decision maker with their primary care team so that they can help advance their own health care. So it's more than just reading, which we think of literacy. It's really evolving now over time.
Yes, yeah, and we've heard a lot about that. So we were able to do a series of focus groups and actually with some of the providers of local health centers. And we had some of our AHA documents and, the fact sheets that we use. But, we learned a lot about exactly what you're sharing. It was, well, we have the information, but just because I give you this infographic or this pamphlet, it doesn't necessarily mean that I'm providing you with those skills to be able to go home and make that best decision for yourself. And something else that we've done is bringing it kind of local here to South Florida. A lot of the languages, the three primary languages are English, Spanish, and Haitian Creole. And I know that we had kind of a lack of resources, especially in Haitian Creole, but in Spanish as well. And so kind of thinking about why is it important to be able to reach patients in, their language and in the space that they're most comfortable.
Yeah, and we have to train our staff to be culturally competent. So some of it is language, understanding the language. And if the health center does not have staff who speak the language or look like the patients that are coming into the health center, we're going to have to supplement that. It could be interpretive services. And there's a lot of technology now that can help if the provider does not speak the language of the patient or the family. So we're using technology for that. And especially you mentioned coming out of COVID, there was a lot of disparities that was seen. We're still seeing that. We're still trying to catch up across the nation for those challenges that came out of COVID. But using interpreters and video chat with patients has been something that we learned in COVID. That was a good thing that came out of that. But making sure that the health center staff and care teams are encouraging each patient to be a part of their own healthcare, making decisions. And part of that is making sure that the health literacy and cultural competency is there.
hmm And how I love that you brought up that you're using technology, and I haven't actually heard too much about that as far as like the interpreters and the translation services. Do you have other examples maybe of how you're using technology to empower patients and improve patient outcomes overall?
Yeah, so one of the tools that we have used is a patient portal. We have been on other patient portals in the past, and the uptake of our patients was not great. It was in the single digits, definitely under 10% of patients were participating and communicating through a patient portal. Now we have health centers that have almost 75 to 80% of their patients are using the patient portal, what we call engagement. So that means the patient can look into their own medical record from home or wherever they have their smartphone or a computer. They can look at their health data, they can look at their problem list, their medication list, and more importantly, they can communicate with the care team. And that engagement at a time when the patient wants to have that communication is so key. So we at Health Choice Network are helping our health centers to engage their patients to not only sign up for the patient portal, but also to use it. And we think through technology, that is the way to have more engagement. So patients no longer have to always come into the health center and in a physical person-to-person meeting. There's a lot of care that can be done between those office visits, and the patient portal is one way in which we can really engage them. It's tremendous. And that's going to advance.
And could you give an example? You mentioned care team, maybe what that team could look like. That it's not just the primary care provider that goes into making optimal health outcomes. So what does that care team sometimes look like in federally qualified health centers?
Yeah, so many of our federally qualified health centers do have care teams, and it is something that we continue to advance under a model called patient-centered medical home, which is a way in which the employees at the health center come together in teams. So let's say I'm a patient who has hypertension. I would have my primary care provider, which could be an advanced practice provider or a physician in adult medicine or family medicine. But then on that care team for that patient, there might be someone who's a health navigator, or someone who's going to have help with health insurance, or it could be the pharmacist. Definitely could be a nurse or in case management or care coordination, someone that helps the patient navigate the healthcare system. So it's not, again, just the provider and the patient in the exam room. It's all of the time we're spending outside of that exam room with a whole care team. Other great examples that are on the care team, not every health center has this, but many do. So registered dietitian or nutritionist. So if a patient has hypertension, we've got to put them on a specific low salt diet. And the nutrition is a very important part of that care team member. Also, many of the health centers will have a behavioral health counselor, behavioral therapist on that care team. So that we're wrapping our services around the patient rather than just the interaction between the physician and the patient. That is old school.
Mm-hmm. And is that what they mean by wraparound services?
Well, a little bit, yeah. The wraparound services really are all those services that I talked about before. It's not just the doctor and the patient anymore. It's having the dentist, the pharmacist, the behavioral health counselors and behavioral health team, along with nursing, the importance of nursing and care coordination and health insurance navigation, just navigating the healthcare system is very cumbersome. So the care team helps that patient. And that's why, going back to the literacy also, it's so important that the patient is engaged in their care. And we have to provide them with tools. And we at Health Choice Network believe technology is one of the tools that we really want to promote. Most people, if not, have access to a computer or internet or smartphone. And that's the technology that we're going to continue to use.
Mm-hmm. That's incredible. And as you're sharing, it's making me think of an example in using technology. So we've been doing a lot of hypertension, so blood pressure work with health centers and doing self-managed blood pressure. And so being able to provide, blood pressure cuffs and monitors, especially to those that don't have access to that at home. And there are loaner programs now where health centers, you're able to take the cuff home, monitor for about 2 weeks time. But we've seen using technology, Bluetooth technology, so that the reading that patient is taking at home goes straight, to that EHR, that electronic health record. How are you seeing, improved outcomes from initiatives like that?
Yeah, that's a great initiative, and thank you. There's been a number of them, Target BP, A Million Hearts. They're great programs, and the remote patient monitoring of patients having their own blood pressure device at home, be able to appropriately take their blood pressure and then read that blood pressure, knowing what their goal blood pressure should be, and then communicating that back to the care team. That could be, as you mentioned, through Bluetooth is one example. There's other interfaces. And even, during COVID, we learned this tremendously, that you're doing a video visit with the patient. They can take the blood pressure in front of the care team member and then show them or display what the blood pressure actually is. That's at least, everyone can do that. That's at least minimum. But we'll start advancing technology to make sure that everything is interfaced or integrated. And that's where Health Choice Network comes in as a healthcare IT company. Mm-hmm. And using, the blood pressure device is one of them, but remote patient monitoring scales are also important. And other types of, for diabetes, there might be continuous glucose monitors. So all of this is going into, managing cardiovascular disease, hypertension being the most common. But those patient remote monitoring tools are fantastic. And there's hundreds of them on the market. So our role is to make sure that the health centers are appropriately purchasing or receiving those devices, and then making sure that patients are appropriately utilizing those devices.
Mm-hmm. That's phenomenal. So we've talked a lot about, kind of engaging patients and empowering patients. Want to talk a little bit about how are you also empowering providers, that healthcare team? We talk about cultural competency. So one of the components of our work together has been to provide cultural competency trainings to health center staff. And it's not always, as you mentioned, just the primary care. It's the dietitian. It's the person at the registration who's, welcoming someone. So I want to talk a little bit about how do you as HCN provide support also for health center staff?
Yep. Well, partnering with the American Heart Association is one example. We have to have partners in this effort, and cultural competency is extremely important. Health centers oftentimes have training programs themselves, but then also partnering with Health Choice Network or the American Heart Association to have different types of training. As you know, we can't give the same training every year, and cultural competency training has to be really targeted. Most community health centers know who their target population is, and if it's cultural competency towards one group, meaning that's the group that our staff need to learn understand and be competent in, then it's a specific targeted program for that health center.
Mm-hmm. And I think that's the use of health workers, health navigators as well. And it's important. It's what you were sharing as having the face of the community be present, as you do at the national level with the board, but then also at the health center level. And for health centers that don't even have community health workers, we've heard locally that they're partnering with other community organizations. And so I think you all also have a model of working with community-based organizations for overall collaboration, right?
Yeah, absolutely. We could not do this work in isolation. We can't work just in an island over the health center or even the network. We have to have partnerships. And this partnership with the American Heart Association is one example of many. And many of our health centers throughout the country, they will partner with local, could be community-based organizations, churches, and other organizations where the community health worker might not be employed by the health center, but they're partnered from another group, and then could go into the homes of those patients or meet them wherever they're at church or barbershops or schools. Mm-hmm. And we have many school-based health centers, across the country where we're doing a lot of work in schools.
Yes. Yeah. You mentioned barbershops. It made me think about that's something that we're, digging into a little bit at the American Heart Association as well. And kind of, we talk about like a clinical and a community like gap or divide. But how can we meet people where they are, whether that's at the library, at the barbershop, at a place of worship, and, being able to also provide health education there and referral as well. So something that we've been doing with barbershops is maybe having a blood pressure station there. And someone who's, going in for a haircut may also have a chance to take their blood pressure and might realize that it might be elevated. It might be a little bit high. And how do we have the resources there in the community so that they can be referred, then to health centers and to local clinics? And so how do you see, I guess, kind of this, almost like a shift or, as we're kind of moving towards the future and innovation. How do you see that impacting health outcomes?
Yeah, I think we have to meet the patients, as we said, where they're at. And the majority of the time, they're not in the doctor's examining room. So the majority of a person's life is at home, at work, at school, at church, or the grocery store, wherever that is. And I think we have to bring healthcare to where people are. So that could be, using community health workers. It doesn't have to be the health center staff going out, but we do have technology. Everything's mobile. We can bring a laptop or a tablet, which has connection to the electronic health record, has all kinds of data and information there, using remote patient monitoring, at the barbershop or the school or whatever. And so that connection needs to be made, and health centers are going to play a part, not the only part, in providing that health care. But certainly we at Health Choice Network are the connector of that, linking up the health center staff, whether they're going out and doing maybe even street medicine, which many health centers here in South Florida do, meeting again the patient where they're at. It could be under a bridge somewhere. And that person whose blood pressure is high under the bridge, doesn't have medications, doesn't have anyone to check their blood pressure, is going to end up in the emergency room. That's what we're trying to prevent.
Mm-hmm. I love that you said that, the connector. Sometimes that's what me and my team talk about as American Heart Association, where, at the end of the day, helping to connect our community organizations, our clinical systems, connect communities to the resources that are needed to advance health. And it sounds like that's what HCN overall, I was noticing in the logo, it's a family of health centers. And so I guess just maybe sharing and touching on that, how have you seen success in using kind of this collective and this collaborative model towards health?
Yeah, so that is what Health Choice Network is. We are the connector. We are a network. We bring together health centers, as we talked earlier, from 20 different states and territories, to learn about the best or promising practices that one health center might be doing. So let's say a health center in New Mexico is doing phenomenal work somewhere out in the community with blood pressure devices and monitoring. We'll take that knowledge from that health center in New Mexico and bring it over to Hawaii or maybe Puerto Rico. So we bring together on monthly work groups all the time on a number of different disease states, cardiovascular being one of them, where we share those promising practices. We share resources. We share information using, not only technology, but then also a lot of the material that Health Choice Network provides within the ER. So like information like HealthWise is our information sheets that we give out to patients, and just making sure that connection is made.
That's fabulous. So monthly collaboratives, do you guys have, because it's nationwide, do you have kind of like a regional gathering or nationwide gathering that happens as well?
They're often nationwide. So for our colleagues in Hawaii, we have to have them in the afternoon because there's about 5 or 6 hour difference. But we have a number of monthly work groups where we bring together the care team members. It could be nursing staff, behavioral health, oral health, or the medical team together to share those promising practices, to talk about the data that's coming out of our electronic health record systems, to identify the best, what we call workflow, or how do we move patients through the health center in an effective manner to make sure that the patient is getting the right information at the right time. So that's our role. And we have many, many, many monthly work groups bringing together all of those health centers. It could be a number of different topics. It could be cardiovascular disease, hypertension with cardiovascular disease, diabetes, quality work groups, behavioral health, HIV/AIDS. So there's all kinds of different health information that we bring together.
Yeah, and I'm sure the health centers appreciate that. I can imagine, again, just as we're trying to address health outcomes, address health disparities, learn the newest technologies, it's probably great to be able to have a space to come together, to congregate, and to learn from one another. I want to hear, is there anything, I guess, that we haven't touched on yet that you think is important, especially as we're talking about heart disease, leading cause of death in the U.S. when it comes to, advancing health and addressing health outcomes?
So as a primary care physician, internist, doing mostly adult medicine, I want to be a strong advocate for everyone must have a primary care provider. That could be an advanced practice nurse, a physician assistant, or a doctor, but everyone has to know who their primary care provider is and that care team. And through federally qualified community health centers across the country, there are 1,400 of them with, thousands of different locations of care. People should feel that they have access to care, direct care. So I would encourage everyone to know, hey, who is your primary care team? Where is your primary care home? Where do you go if you have an issue with healthcare, need to have preventive health screenings? I think a second thing out of that is, because of COVID and people not coming into the doctor's office or the provider's office as much, I think that we're going to see a lot of gaps in care over the next several years. So that could be from preventive health screening, it could be, hypertension and stroke. And so those are things that we've got to play a little catch up. So if everyone could identify who their primary care provider is, know that care team, and then go into the office and then engage your healthcare team between office visits using technology.
I think that's important. And for us to really address those disparities, that's exactly what we need to do. I know that we had an initiative that was called Doctor, It's Been Too Long. It kind of came from our work during the pandemic. How do you encourage patients? I think there's sometimes a fear, of maybe going to the doctors, or I haven't been in a long time. I don't know how to look for a primary care provider. What advice would you give to someone, who's seeking that? Just, I don't know where to start. How do I start?
Well, you got to start where you're at. So the first thing is knowing where your community health centers are across your neighborhood, wherever you live. There is a community health center everywhere across the country, rural and urban, and just knowing that you have access to that health center. I would recommend you go in, talk with the care team member, make an appointment, and if you hit it off with the care team member, right, then you can engage them between office visits. But I think it's just making sure that everybody has access to healthcare. You just have to take that initiative. And then from the health center side and the health center controlled network side, we need to provide care to the patient, how they want it, where they want it, and how we engage them, I think, is so important. I think we in the federally qualified community health center movement are trying to meet that gap between where the patient is and where maybe the provider is right now.
Wonderful.
And that's our role.
Yes, no, that's wonderful. And I'm so happy that we got to, speak today a little bit about this and our collaborative. I know it means a lot to me. I learn a lot from everyone at HCN, and I hope that you guys learn from me as well. But, we share information and we share resources together, and the work that we're doing is exactly that. And so I know for us, as we're celebrating now, moving into our second century, we're wanting to talk about advancing health and hope for everyone, everywhere. And so that's at the base of what we do. And we're always happy to be able to collaborate with you all at Health Choice Network and all of our other community organizations. So thank you so much for sitting and having this conversation with me today.
Great. Thank you for hosting this, and we really appreciate it. We look forward to the collaboration.
Wonderful. Thank you.